Lisa K. Donner here for Liberty Nation, and with me today is Alexandra McClure. Alexandra is a physician's assistant in the emergency room of a hospital in Ohio. How are you today, Alex?
I'm wonderful. I actually just finished a shift and just got home.
Well, thanks so much for joining us today on Liberty Nation, LNTV. First off, has anything changed in the ER? Do you have to wear different clothes? Is anything really different for you?
Actually, a lot has changed. So clothing, mask wear. So we enter into the emergency department. A lot of nursing staff is actually having a temperature taken before they even start their shift to ensure that there's no fevers present at that time. If we have a specific coronavirus / respiratory section now designated in each of our ERs. So if we're considering that they might be a respiratory patient, they'll be sent to that section immediately. And then after assessing the patient's vitals and initially how they're even doing, we'll go ahead and decide if we need to do a full workup, such as we'll dress in full gown, gloves, double gloved. We have to wear an N95 mask. And then on top of that, a face shield in every single patient that we see that's any type of respiratory.
What is an N95 mask?
An N95 is a specific mask that provides protection more so for patients as well as the person that's wearing them, the medical provider, whether it's a physician assistant, nurse practitioner, a doctor. It basically prevents the amount of air that's going in to the mask, so it actually suction cups and forms to your face. We actually were all fitted for them about a couple months ago. I would say when all of this started, we were aerosoled in almost like a ventilation area to make sure that no air was getting into our masks to protect us from everything.
All right. So have you seen a general uptick in activity in the ER or a slowdown? I was thinking today, unless you really have something wrong with you, do you really want to go to the ER? Or on the other hand, maybe if you're a hypochondriac, you're kind of worried about every little thing and you hop off to the ER. What's the traffic like there for you?
So I would say that initially when everything came about, everyone was flocking to the ER. I would say patients that weren't as sick, that probably shouldn't have been there, were coming. Everyone wanted to be tested, but then everyone was made aware that testing isn't as readily available as we need it to. As of right now, unless someone is admitted to the hospital and we're suspicious of the coronavirus, we're not doing the testing at this point. So after that initial, I would say, pandemic scare of everything, now we're actually truly seeing sick patients that are coming into the ER. Most of the people aren't coming unless they absolutely need to. I would say our volumes have actually decreased.
Okay. Have you personally come across anyone that you wanted to refer to that special section that, might have had the virus?
Actually, yeah, I had 2 patients today that I took care of, and I'm pretty sure that one of them at least was positive for the virus. So when I saw each of those patients, I was fully gowned and gloved and 2 masks, and I stripped down all of the wear right as leaving the room, and then you wash your hands for at least 20 to 30 seconds. So yeah, anything that I was really concerned about, I was fully prepared in full what's called PPE, protective gear.
All right, now you're a professional. Everybody in the ER is a professional, but do you find yourself especially personally fearful of this virus, or is it kind of de rigueur for you?
I'm a little nervous. I would say that, I've seen flu-like symptoms, the flu itself. I've seen the rhinovirus. I've seen pneumonia. And then I've seen patients with this. It seems that these patients decompensate very quickly. And I've seen it at all age ranges. I've seen it in a 40-year-old. I've seen it in a 70-year-old. Obviously, if you're older and you have multiple comorbidities, such as lung disease or COPD, or you're a smoker, you're going to do much worse than the other patients. But that doesn't mean that the younger patients are going to do better necessarily. So I would say, yeah, it's definitely scared us as medical providers, and that's why we're taking all the precautions necessary.
Okay, so you used a word in there that I'm not sure the general audience knows. It was a decompose.
Oh, decompensate. So when a patient's baseline status decreases, so they go from having normal breathing rate, normal heart rate, normal blood pressure, and then within 6 to 8 hours of even being in my ER, they decline. So they're needing to require oxygen, then they're needing to be ventilated, meaning they're going to need to be intubated. So they just seem to take a decline very quickly.
Okay, from a healthcare standpoint, do you think that the government's response has been overblown, just right, too minimal? What's your professional opinion?
I think it's been good. I think that we responded much more quickly than, China, just because we knew what was coming with everything. I think we're taking the proper precautions. I think the social distancing is needed at this point. I think that's the only way that we're going to contain everything. Proper hand washing, people being very careful about just taking care of themselves as well as not infecting other people is very important.
Okay, and how are your colleagues, the other healthcare workers, holding up in your community? It would seem that there's a whole lot of pressure on you guys lately. I mean, do you find yourself, just kind of burned out here?
I think we're doing a good job of trying to take care of each other. For like today, for example, I knew my coworker had picked up a lot of shifts recently, and I actually had the last 2 days off, so I actually offered to split the shift with her. So we're trying to do what we can to take care of each other. I think it's brought us closer together, especially in my hospital. The advanced practitioners as well as the doctors were working really well together to do what we can to see the patients. A lot of the time when we come in, we'll designate a few providers just to see the respiratory area, so not the rest of us then aren't exposed possibly. Some people will step up. Myself, I'm not married, I don't have children, so I'm stepping up for some of the pregnant doctors or anybody else so that, those people are less likely to become infected.
All right, and finally, do you have any words of wisdom for our listening and viewing audience?
I would say, do what everyone is saying at this point. I mean, the virus is very real, not to scare everyone, but I have seen patients not do well on this, unfortunately. So properly washing your hands and covering your mouth, and every time you touch something, make sure that you're cleaning it off with the proper sterilization techniques, and staying away from younger people such as infants, or as well as elderly people or anybody that has illnesses with lung conditions or such as diabetes or heart disease. Anybody that you think could be at risk, just staying away from them, taking your shoes off in the garage, washing your hands, washing your clothes, doing what you can to do your part. Any little bit will help.
Thank you very much. That's Alexandra McClurg, who is a physician's assistant at an emergency room in Ohio. Thanks so much for being with us here today on Liberty Nation.
Thanks for having me.
Hi, folks. Lisa K. Donner here, editor-in-chief of LibertyNation.com. We hope you enjoyed watching this video, maybe even learned a thing or two. If so, please take a moment and subscribe to our YouTube channel right down there in the corner. Thanks so much.